supervisors of more than 500 community health workers across the province, and they are complaining about neglect. They say they were told not to report for duty in April, but were promised a contract of employment set to begin in May, which has still not been signed. They say they have not reported for duty and have no salaries, while their subordinates are still on duty with no supervisors to report to.
We are 565 nurses of the Eastern Cape working for the department for 8 years on contract basis that will have been renewed after 31st of each year. This year we're told to stay at home. Then government promised us 3 months contract while we were waiting for permanent post that has been granted by the government, by the department. So we are still not on duty. We didn't get paid on April, and March now is in the middle. Then we are afraid of we are not gonna get paid.
We can see that at the rate that this is going, I think that possibilities of unemployment, the whole group being unemployed, is very possible. And that is a painful thing because we are the people who actually help other people and we love our jobs. We have families that we need to feed. We really need our jobs. We want them back actually, as per the promises that were made to us. We have been faithful to the department for so long, and yet this is what we get.
While others are pleading for contracts, Nyandeni local municipality community health workers have signed contracts and received appointment letters. However, they say they were told via WhatsApp not to report for duty.
We signed a contract May. The contract is for 3 months, May, June, July. Then ngoku asikaqalisa ukuphangela kuba sifumane i-message on the 5 kwakuSunday ebusuku isithi masinga-assume i-duties. Sihleli asiphangeli.
While the department is encountering delays in effecting the 3 months contract, it has urged the nurses to apply for the advertised permanent positions.
So the department is in the process of recruiting the same cadres on a permanent basis. The advert is out and it is still open for them to apply. We understand that recruitment processes take time. Therefore, we have undertaken to extend, not even to extend, to reappoint them for another 3 months while the recruitment process is underway for permanent appointments.
The department says it continues to face budget constraints which limit its ability to employ more health workers. Sidi Mamvegu, SABC News, Bhisho in the Eastern Cape.
Let's bring in some reaction now from the Eastern Cape Provincial Secretary of the Democratic Nursing Organization of South Africa, Veli, Sinqana, who joins us now. A very good evening to you. Thank you so much for your time. A lot of complaints about neglect and promised contracts of employment which have not materialized as yet. What is your view on this?
Good evening, Paul and the viewers. Yes, indeed, as DENOSA, we are really concerned about the inconsistency within the Department of Health, because we understand that some of the employees signed the contract but not yet at work, and at the same time we are concerned about this thing of renewable contracts, whereas we are looking forward for the permanent employment of the workers, especially the importance of the role played by these workers on the ground. So we are really concerned about that.
How best do you think that this issue can be addressed? Because on one end, the department speaks of budgetary constraints, jobs have been advertised, and promises of reappointment for another 3 months have also been put on the table.
The problem, we can even say there is a challenge in terms of the communication within the department and the effectiveness of the personnel, because at times we are informed that the processes are taking place and find out that the processes are being prolonged. Hence, we are concerned about the effectiveness of the personnel, that especially in the HR area, because there's no way for people that the posts are there and there are funds, and it takes time for those posts to be filled.
And what would you say in interacting with some of your members? I mean, the biggest frustrations around this, really not knowing what will happen in the next few days or whether or not they'll be able to put food on the table. What are some of the frustrations that you're hearing?
Yeah, you know, those are members from the families. Some do have kids at school, so they need to put something on the table. And now the delays of the department lead to more frustrations to the members on the ground. And at the same time, this is not only affecting the members, it also affects the communities, because you'll notice that those people, some are school health nurses, some are healthcare workers, some are working as outreach team leaders, which part of the component of the NHI, which we just signed only yesterday, but just signed only yesterday by the president. Then the primary healthcare re-engineering is one of the primary components of the NHI. So this affects the society at large.
You speak about the NHI, and of course we know that as it is going to be rolled out in its phases, nurses and healthcare workers and doctors will be central to ensuring that it does work out effectively. But of course, we know of the many challenges when it comes to a shortage of nurses and healthcare workers as well as doctors in the country's hospitals. Do you think that in its current form, the NHI can be effective?
I believe that the NHI can be effective because the NHI is going to be implemented in phases. And at the same time, we will note that it has been piloted for a couple of years, and such re-engineering are an outcome of the pilot of the NHI. Hence, today you are talking of the outreach teams. So the NHI can be successful if it is implemented in phases.
How will it then assist in mitigating some of these challenges that you and I are speaking about now? There is a shortage of nurses. The ratio is, there's an imbalance when it comes to patient to nurses as we take a look at the entire country as well as doctors. How then do you think that it will be effective in mitigating some of these issues? Because posts need to be filled and rather urgently.
Yes, indeed, we've been calling for the posts to be filled, especially the vacant and funded posts that need to be filled. So if the department, not only at the provincial level, but at the national level, fill those posts and bring the fund in order to ensure that those vacant posts are filled, I believe that the NHI can be effective.
Very well. Let's perhaps leave it there for now. Thank you for your time. Eastern Cape Provincial Secretary of the Democratic Nursing Organization of South Africa, Veli Sinqana, joining us there to talk about some of the grievances that nurses in the Eastern Cape on the ground are experiencing, and of course some reaction to the National Health Insurance bill being signed in.